So, good afternoon, everybody. I am very happy to be able this afternoon for our webinar to introduce to you our dear Dr. Vishakha Mahindra. She is a medical doctor of Ayurveda, and she has a distinguished career of more than 16 years of practicing Ayurveda. And she got her formal education at Pune. And she works with a mission to propagate the principles of Ayurveda in the whole world to create self-awareness among people for their well-being. And she is working as Ayurveda expert, traveling to many, many countries all over the world. And she has great knowledge in the area of Ayurveda, and specifically practices for Ayurveda healing measures for infertility, gynecological disorders, obesity, and related complications, musculoskeletal ailments, metabolic and hormone imbalance complaints, skin disorders. And she has great success in healing and strengthening the neurological system in patients with the aid of Panchakarma therapies. She is practicing transcendental meditation for many, many years and gives awareness to people to benefit from, to benefit them with mental health to combat the stress. And she is traveling, giving Ayurveda consultations, and impart corrective and preventive approaches to overcome modern lifestyle syndromes, and has provided customized health plans in terms of diet, lifestyle, and herbs. And Dr. Vishakha has actively participated in organizing camps at various places in India to spread Ayurveda knowledge to society, and has authored several health awareness articles in Times of India. So it's a great honor to welcome you to give us your knowledge. Specifically, the topic of this afternoon lecture is Ayurvedic rejuvenation, Vayikarana, and Rasayana therapy. And on behalf of Ambassador of India, Raj Kumar Srivastava, the Embassy of India in Croatia, we are welcoming you with full heart to start the lecture.
Thank you, Mr. Jadranko. It's a pleasure to be here. I thank Mr. Jadranko, Ms. Tina, our ambassador, and all the people present here for this patient listening webinar. As Mr. Jadranko mentioned, we are doing the webinar on Rasayana and Vayikarana. Although it's a very vast topic because it's the main branch of Ayurveda, but we have tried to suffice it in a smaller form. So I'll be sharing the PPT, the PowerPoint presentation, so you can catch few of the Ayurveda words that I'll be using during this webinar. And we'll take a few of the questions if you have any. So we'll be starting with this PowerPoint presentation. I'm sharing my screen. Just let me know if it's visible or not.
Yes, it is visible.
Just a minute. Let me see if I can put it over a slideshow. 1 minute. So it's visible to everybody, I hope.
Yes, yes.
So Rasayana and Vayikarana therapy. So a few words about Ayurveda. Ayu means life and Veda means science. We all know that Ayurveda is a science of life, prevention, and longevity. It is the oldest but yet organized Indian medical system that has its own fundamentals through all the Vedas, like Upanishads. It is a comprehensive medical system of body, mind, and spirit. Ayurveda is said to use the inherent principles of nature to help maintain health in a person by keeping the individual's body, mind, and spirit in perfect equilibrium with the nature. So Ayurveda is considered as more than a mere healing medical system. It is a science and art of appropriate living, which helps to achieve longevity. It can also guide every individual in the prevention of disease and long-term maintenance of health. These are the branches of Ayurveda. So I have put all of them together. There are 8 branches. One is Kai Chikitsa, that is for medicine. Bala Chikitsa, that is for pediatrics. Griha Chikitsa, that is for healing of psychological problems. Urdhva Chikitsa means upper respiratory tract diseases. Shala Chikitsa are for surgeries or surgical operations. Visha Chikitsa is for toxicology. Rasayana Prakaran, that is to rejuvenate the sub-dhatus. Dhatus are the tissues. And Vayikarana, that is the science of aphrodisiacs, virility and improving health of progeny. So here today we are just covering the last 2 parts, Rasayana and Vayikarana in short, in a summary form. Rasayana. Rasayana, when we break the word, Ras plus iron. The Sanskrit term Rasayana is a combination of 2 terms. Rasa means the best or the finest part or the constitution fluid or in the body. Iron means going. Whatever juice or whatever residual we are finding throughout the tissue level breakdown, that is called rasa. And iron means circulation. Whatever is moving throughout the body is rasayana. So rasayana means the best constitution fluid circulating throughout the body. Initially, when we are young, this rasayana therapy we don't need, or we need it in a smaller form. We don't need to practice it again and again, because our body has that capacity to absorb things, to fight diseases, to improvise our luster, everything. But yes, when we are practicing rasayana and vajikarana from early lifespan, it helps to combat a lot of disorders that are usually happening in geriatric phase. So this state of improved nutrition leads to a series of secondary attributes like prevention of aging, longevity, immunity against diseases, mental competence, and it increased vitality. Rasayana is one of the 8 clinical specialties of classical Ayurveda, as we discussed. It appears to have been practiced since ancient times as an important specialty aiming at rejuvenation and geriatric care. Rejuvenation is rejuvenating not our own body, but our mind, our soul, everything. It is not a drug therapy, but a specialized procedure practiced in the form of rejuvenation recipes, dietary regimen, and special health promoting conduct and behavior. We called it as Achar Rasayana. It's a part of Rasayana. The focus of Rasayana is accelerated and appropriate nutrition leading to improved biological competence of the body. So classification, there is a lot of classification that is mentioned in our text. So here I have tried to summarize it. As per scope, Kame Rasayana. Kame Rasayana has 3 parts: Prankamya, Medhyakamya, and Srikamya. Prankamya is promoter of life and longevity. In all these Rasayana classification, I'm just mentioning this because when we go ahead, there are many herbs that are available in various parts of the world that helps to improve that particular Rasayana. So for every classification, there is a particular Rasayana. So we need to follow it, or we need to consume it, or we need to detoxify it through that particular herb. So it is very, very helpful, and it helps to achieve Rasayana very easily. So Medhyakamya. Medhyakamya is promoter of intellect. All the Rasayan drugs also improve the mental faculties in addition to beneficial effects on the body. The major Rasayanas, though drugs which have specific effect on mental performance, like we call it as Chankapushpi, Brahmi, or Vacha. So these are Medhyakamya. Usually we tell smaller, younger children to consume Brahmi more so as to improve their intellect or their memory power. So this Medhyakamya is very specific and very elaborately present in our text. Then it is Srikamya Rasayana, that is for complexion and luster. Many people are fond of looking good, beautiful. The skin should not have wrinkles. So this Srikamya Rasayana is helpful in that. Then comes Naimittik Rasayana. Naimittik Rasayana is specially in specific diseases we use. Like for Prameh is diabetes. We use Shilajit. Kushta is a type of skin disorder. So we use a specialized herb that is called tuberak. So when we take this Nemitic Rasayana continuously, whosoever is having skin disorder or any disorder, any acute disease, it will be helpful, or it will help to combat that disease, and they no need to put them on any stronger steroids or medications that way.
Dr.
Yes.
Vishak,
Yes.
the slideshow is not moving. If you are
Okay, it's not moving.
Yes, it's
It's
just
moving.
on the first.
Okay, look, 1 minute. I need to, then I'll stop the slide share and just I'll move towards the direct.
Okay.
This is okay. Can you see it
Yes,
now?
yes. Now it is.
Okay, so do I need to repeat, or is that clear?
Yes, it's clear.
Okay, so next classification is as per method of use. Here in India, we follow a lot of these practices for Rasayana. One is Vata Atapic Rasayana, that is for outdoor regimen. This Rasayan therapy is administered to a particular person. He is exposed to external atmosphere and sunlight. The person can live everyday social life with Rasayan therapy. The restrictions are comparatively less in Vata Atapic Rasayan. Next is Kuti Praveshik. This is indoor. So we make a kuti, we make a smaller chamber that's isolated. It has strict regulations on diet, even moving out of the house. It has a prescribed formulation or some physical activities that has to be done there itself. So this is therapy is completely focused on physical, mental, and spiritual upliftment of a particular person. So as per Kuti Praveshik, it is the best Rasayana that we found in text. And if there are many of the organizations that are performing this Kuti Praveshik Rasayana in their particular clinics or the medical facilities. Next is as per the contents of Rasayana. One is Aushad Rasayana. Aushad is drug, means medicine, the herb. So we use Aushad Rasayana. For example, we are using Shilajatu in diabetes, or we are using Maharasnadi in joint problem. So this is Aushad. Aushad is herbal. Then is Ajastrik Rasayana. This is dietary Rasayana. We in Ayurveda mention that diet is half treatment. Half treatment is done if you are following a complete Rasayana. So it is very good if you can maintain this nutrition through food. Yes, obviously that food has to be healthy, freshly cooked, or kept in an optimum temperature. So no frozen food has to be accepted here. The Ajasik Rasayana gives result only if we are having good dietary regimen and good nutritional food. Then is Achar Rasayana. Achar Rasayana is the behavior that we follow, like doing exercise regularly, maintaining a good regimen, good dinacharya. So Ajasik Rasayana, as I mentioned, some of the nutritious diets such as milk, grit is ghee. Usually we have a lot of questions regarding ghee. Ghee increases cholesterol. So I may correct on this. Ghee does not increase cholesterol if it is taken in a right amount and at the right time. Especially the cow ghee is very safe, and it will never increase your lipid profile if you are taking it in the right manner. So if you want to consume milk or grit, I would suggest please consult your Ayurveda expert regarding the same, so that they can help you with this. But yes, if you are taking this ghee and milk, the bones are in good shape in geriatric age also. So I would prefer this Ajasik Rasayana is equally important than Achar Rasayana. Achar Rasayana is like good conduct. Good conduct means we are doing meditation, we are doing prayers, we are not angry on somebody, or we are trying to help, like it is a kindness behavior. We're not having alcohol or smoking behaviors. Then some study or sadacharya. Sadacharya is like we are doing everything in the right manner. So that is sadachar. So if we are doing it, this helps our mental state to form in a good shape. So Achar Rasayana keeps the aspirant free from emotional disturbances and permits a less stressful life with pronounced anabolic state leading to due health and happiness. Ayurveda appears highly empathetic on this issue, that it is why it introduces the concept of Achar Rasayana as the rejuvenating konda. So when we are talking about Rasayana, Achar Rasayana and Ajurvik Rasayana is the main thing we need to follow. And while we are following this, I think we are trying to cover whole Rasayana and Vayikarana, because Vayikarana is indirectly related to Rasayana only. When we are improving this, when we are going towards Vayikarana, you will understand how Rasayan therapy is equally important and how this is helpful in Kamya Rasayana that we classified. So goals of Rasayana, as we discussed, lifespan and aging, lengthen the lifespan, stay young, stop and reverse aging and its signs like wrinkles and graying, health, renew or retain functions and senses of body, overcome diseases, particularly serious and challenging diseases associated with old age, cognitive power, it increases the memory. The students or the intellect, they get more smarter, they understand more, the grasping power is more, and virility, it boosts stamina, it makes you more stronger and become more fertile. So virility is important both for males and females. So Vayikarana will be a thing that we'll discuss for the same. Okay, few of the Rasayana Dravyas. You must have heard a lot about Ashwagandha, Giloy, Amla in this COVID situation. So we in India have discovered the people who are already taking these Rasayana herbs had got much easily recovered through COVID rather than the people who are not consuming it. Like they did not consume it suddenly. They did not start ashwagandha suddenly. They are taking this Rasayana therapy from long, maybe 3 years, 4 years. And this helped them to beat those COVID symptoms or the COVID repercussions. So it was a boon during COVID that we could understand, yes, while taking these herbs, it was a great thing that we could manage those particular patients easily. Some of the major psychomodular rasayanas are Shankapushpi, Muleti is Yasti Madhu, Glazia glabra, Guloy, and Mandukpani. So these all herbs are helpful in mental disorders. I'm not mentioning any particular disorder, but yes, a lot of mental disturbance also is when we give these drugs, this is very, very helpful. So these are few of the Rasayana Dravyas that I have just mentioned here. There are many more, but yes, these are easily available, and we usually know these names. Like ashwagandha is very popular for a nervine tonic. It was very easily used in COVID situation, so it is very helpful. Again, few people are having less strength, or they mention that after coming from work, they usually get tired. They want to sleep. They don't want to eat. They don't want to cook. They don't want to do anything. So this ashwagandha and giloy has particularly increased the stamina. It has helped to boost the stamina in those particular patients. So it is again a very nice and best rasayana dravyas that we found in our text. Next, as we used some of the rasayana herbs that we use in disease specific, like we were talking about nemetic rasayana. So these have a lot of we have got a lot of herbs mentioned in the text that is particularly used in these particular diseases, like Vijayasara or Shilajatu in diabetes mellitus. Katuka is very popular here in liver disorders. Then Vidang is used in worms or gastrointestinal problems. So these are few of the herbs that I have put over this slide just to know that yes, we can for a particular disease we can pick up those single herb and use. But yes, over the period of time it gives results because it's a rasayana herb. It helps to improvise throughout the body. So it takes time, but yes, if you are taking it, people who are suffering from long liver disorders or skin disorders or diabetes or something, some allergies, they are really helpful in those particular diseases. So again, it is Rasayana used in disease specific as mentioned in text. So benefits of Rasayana. Since the first slide, we are just mentioning the benefits. The primary objective of Ayurveda are preserving health and preventing diseases. This is what Ayurveda is all about. We have to preserve our health and prevent diseases. Yes, if you are already diseased or you have those symptoms, Ayurveda helps with that also. But the main aim is to preserve health and prevent the diseases. Rasayana treatments are important in preservation of health, prevention of diseases, speedy recovery, and rehabilitation from disease condition. This was a life thing that we understood during COVID. In current practices, antioxidants, immunomodulatory, adaptogenic, anabolic, nutraceutical, anti-aging therapies are considered forms of Rasayana therapy. So whatever form we are giving those particular herbs, they are considered as Rasayana. Ayurveda advises body purification before administration of Rasayana therapy to achieve optimum benefits. Body purification is Panchakarma treatments. This is again a major part of Ayurveda treatment that we usually, if you want to start with a Rasayana, your body needs to be clean. Otherwise, it takes a lot of time for the body to accept that particular herb or to go ahead with that particular thing. So we always tell, go for a body purification every 6 months. It is really helpful and it helps to rejuvenate very, very easily. I know there are very less people who are practicing Panchakarma over there in Croatia, but yes, people are getting benefits. People are getting a lot of health improvements if they are doing Panchakarma and then following Rasayana over it. So Rasayana therapy provides longevity, good memory, intellect, proper health and youthfulness. It also provides excellent luster, complexion and voice. Once you will start taking these Rasayana therapies or rejuvenation therapies, you will find a lot of difference in your own body. The strength of body and sense organs are increased. Perfection in deliberation, respectability and brilliance are also achieved by Rasayana therapy. This therapy relieves excessive sleep, as we mentioned, some drowsiness, exertion, exhaustion. This helps in that. It restores dosha balance. Ayurveda is all about dosha. Like we talk about vata, pitta, and kapha. So it maintains those particular doshas. Doshas are present. The three doshas, like theory is, it is present in everybody's body. But yes, equilibrium is the main thing that we need to balance while we restore the doshas. So again, Rasayana helps to restore our doshas in a particular balanced state. It brings stability, elevates laxity of muscle, and kindles internal digestion. The person can achieve blissful health if they are taking Rasayana therapy for long, or they are taking it for their own particular reason or disease as well. So I would suggest Rasayana therapy is equally important if you are doing your daily schedule, like if you are practicing yoga or if you are doing exercise. If you can add on with the Rasayana therapies as well, it will be a great help to your own body. Rasayana therapies can promote health and prevent diseases of mind and body. It is indicated to prevent recurrence of disease by restoring equilibrium of body constitution. Importance in management of disease, as we mentioned, it is helpful in management of a particular disease. It promotes the defense mechanism of the body. So if we are increasing our immunity, increasing our strength of the body, it helps to fight with that particular disease. Again, I'm mentioning it may take some while, it may take some time, but yes, after a particular time, it will be a great help to your own particular body. The Rasayana medicines with specific actions of affected tissues and organs are indicated in managing respective diseases. So if somebody wants Rasayana for a particular disease, or they want to get rid of a particular disease, Rasayana is an add-on feature to their herbal schedule of medicines, we always put a Rasayana in that particular this prescription of a particular patient. Okay. Contraindication. Who cannot have Rasayana? The efficacy of Rasayana therapy depends on person's ability to control his body and mind. So rejuvenation or Rasayana therapy is contraindicated for those who have addictions like alcohol and smoking, and those who cannot follow the physician's advice. In our text, it is clearly mentioned, if you cannot understand your physician's advice or if you are not following it, nothing will help you in a particular medicine or diet as well. So we always ask for habitual activities they are having, a particular patient. If they're having addictions of any alcohol or smoking or any other thing, morphine also, we try not to give them Rasayana because that will not help that particular person. So we always tell them, if you want to go for Rasayana or rejuvenation therapy, you need to follow or you need to withdraw with those addiction therapies. Regimens and mental factors with Rasayana effect. Yes, being truthful, free from anger, calm, soft-spoken, relaxed, loving and compassionate. If you are practicing meditation, brahmacharya is celibacy. Cleanliness and proper sleep achieves the benefits similar to rejuvenation therapy. Now, everybody will have a question: how can we be calm? How can we so soft-spoken in this rushy life, in this hectic life? Yes, but if we are practicing meditation, like I am doing transcendental meditation since very long, if you are practicing any kind of meditation, it helps to increase these factors. It helps you make more relaxed. It helps you make more loving and compassionate. It helps to decrease anger. So if you are following these things, it is a great help towards increasing rejuvenation of mental disorders or mental disturbances. It is very good for psychological and spiritual well-being if we are following these kind of things. So Rasayana is good for physical as well as mental thing as well. So moving on to Vayikarana. So Vayikarana, give me a second, please. So Vayikarana is another branch of Ayurveda. As I mentioned, nothing can be done other than Rasayana. So Vayikarana is after Rasayana. Vaji and Karana. Vaji refers to horse. Vaji in Sanskrit means horse and Karana refers to power. So Vajikaran is a therapy that refers to horse power. A Vajikarana helps to achieve good physique, potency, strength, and complexion. It revitalizes the reproductive power, helps in getting healthy and good progeny, resolves various sexual dysfunctions like erectile dysfunction, infertility, etc. It is concerned with aphrodisiacs, virility, and improving health of progeny. There are a lot of infertility that is creating these days among many of the patients. The reason, what we usually find is lack of schedule in dietary regimen or lack of proper food intake. That is a great problem amongst a lot of patients these days. So we are trying to first rule out the schedule that to a level that we can. But yes, again, if we are following Rasayana along with that, it helps. But it takes time to improve the fertility or the power or the strength in reproductive tissues, because the Vajikarana is directly related towards Shukra Dhatu. That's the seventh Dhatu. If, we start from Rasa and moving towards Shukra. It's a tissue level disintegration that we get from our nutrition that we take from our own food. So till then, if the Shukra is not in good position, or if the Shukra Dhatu is not in good shape, there is a lot of issues in reproduction, in fertility, there are many sexual disorders that are coming up these days. So we always tell, if you want to take Vajikarana Chikitsa, try to follow Rasayana therapies and diet regimen as well. Because other than that, we cannot go through, we cannot combat those Vayikarana disorders if we are not following it. So Vayikarana should be administered regularly to an individual. Again, brahmacharya, as I mentioned, celibacy. Obviously, brahmacharya cannot be followed or celibacy cannot be followed in every individual. But yet, the activity or it can be practiced in it should not be less or it should not be too much, because again the shukra dhatu is getting affected and it will have a detrimental effect on the body and your mind as well. It is recommended that the person below 17 years of age and more than 70 years of age should not consume Vayikarana preparations, because that particular age group is not made for that. We can give, but we don't get good results in in this particular age group. So these preparations have to be consumed by Jitendra Purush. That means a man who has control on his senses and desires. That doesn't mean that if you are desireful, you cannot have Vayikarana medicines. But yes, you need to, this controlling of desire means you need to have a proper dincharya or a proper dietary schedule, a proper physical activity schedule. You need to have that. This preparations, if you are giving to a particular person who has lost control over his senses, this leads to loss of dhatus, especially the shukra dhatu, and it leads to impotency. So Vayikarana Chikitsa is a particular thing that we need to follow along with Rasayana and in a proper customized way that your Ayurveda experts mentioned. So it is very important to understand Vayikarana, because again, it's always done after a purification therapy. So Rasayana and Vayikarana both are done after a purification therapy. But yes, we want to understand why we are taking Rasayana therapy and why we are taking Vayikarana therapy. Here in India, we are following a lot of Vayikarana Panchakarma therapies that are giving benefits in infertility and a lot of sexual and gynecological disorders. So it's a great help that our Sanhitas, our texts have mentioned, and if we are doing it in the right manner, we are getting very good results after that. So again, by proper use of Vayikarana formulations, one becomes endowed with good physique, potency, strength, complexion, and potent like a horse. Like a horsepower, the body moves. The main aim of Vayikarana is always successful copulation for healthy reproduction, with sexual pleasure being an additional benefit. Therefore, it is considered a part of eugeny. A good progeny is a part of our life, and everybody wants to have children or generation next, and Vayikarana therapy is a great help in that. Vayikarana Chikitsa requires living in strict compliance to the directions mentioned in Ayurveda classics that your Ayurveda expert can help you with for sure. It involves various methods of shodhana, like body cleansing, like Vamana, Virechana, Svedana, or Bastis. We call shodhana therapy. Based upon a particular individual or a particular prakriti. So that again, Ayurveda expert can explain that time, seeing the patient, seeing the pulse. It is a great help with that. Doshic body constitution, we see like the dosha therapy I mentioned, certain herbal and herbal mineral combinations are administered. Other components in the therapy involves improving health and pleasure in general, like massaging with medicated herbal oils and herbal baths. Massaging yourself once a week, twice a week is again a helpful procedure in Rasayana and Vayikarana. So we always tell Abhyanga, we call it as self Abhyanga. It is a great help towards a particular body, towards a particular disease. If we are doing it, it will be very helpful to follow, or to it is an additional feature towards these both therapies, Rasayana and Vayikarana. So again, massaging with medicated herbal oils like sesame oil. If it is a medicated oil, it will be a great help. Or if if according to your own doshas or on your prakriti, if your Ayurveda expert has mentioned, please follow that. It is not only for the people who are having pains or something like that. It is for a whole body maintenance or rejuvenation. So it is a great help. Benefits. Vajikarana therapy is set to revitalize all the 7 dhatus. As I mentioned, Vajikarana is dependent on Shukra dhatu. That comes at the 7th position starting from Rasa, Rakta, Masa, Med, Asti, Majja and Shukra. So these are the tissue level that we get a particular I should mention juice or particular fluid that is formed, and Shukra dhatu is the Shukra, the last 7 dhatu is increased after that. So it restores those Shukra dhatu, and it is a great help to increase the fertility in male and female both. So when we are improvising our diet, our rasa, the fluid, the actual fluid is good. It helps to rejuvenate Shukra. Shukra is both sperm and ovum, sperm in males and ovum in females, and it ensures a healthy progeny. It is a great help towards healthy progeny. Rasayana drugs act inside the human body by modulating the neuroendocrine immune system, and Vajikarana Rasayana is a special category of Rasayana which improve the reproductive system and enhances strength. So as I mentioned earlier, Vajikarana can be achieved if we are having good Rasayana rejuvenation therapies. So Vajikarana also claims to have anti-stress, adaptogenic actions like Rasayana, and helps to alleviate anxiety associated with sexual desire and performances. So if you are following Vajikarana, I would always mention, please have Rasayana along with it. That will be a great help towards a particular disease, or if you are having infertility issues or impotency issues, it will be a great help. Okay, role of diet in Vajikarana. So since we have started with Vajikarana, I am talking about Shukra. Shukra dhatu needs to be nourished. It should be nourished from diet. So if we are using those particular things or diet that improvises Shukra, like that helps to improvise the Shukra dhatu, like milk, like ghee, grit. So it will be an additional feature to give Vajikarana Chikitsa. Now we believe in Dravya Samanya Chikitsa. Like Dravya Samanya is whatever properties you need in the body or whatever deficiencies you have in the body. If you are taking that particular medicine, herbs or diet, it helps to improve it. That is why I mentioned here Dravya Samanya, similarity in substance. That is consumption of food items similar to body tissues, increase them due to similar constitution. Like we mentioned, milk. Why milk is important to increase Shukra dhatu efficiency? Milk has exactly the same properties that Shukra dhatu has. So if we are taking milk in the right quantity at the right time, it helps to increase Shukra dhatu directly. It is a great help to increase Shukra dhatu. So we always tell, if you are having good cow milk, again I'm mentioning fresh cow milk if you get, or fresh goat milk if you get, it is again a very good enhancing factor in Shukra dhatu. It is a great help, and again the Vajikarana Chikitsa is having a step ahead to improvise those particular disorders that are having due to less nutrition, or if they're not taking the nutrition in the proper form. Okay, few of the Vajikarana formulations that I mentioned earlier. Rice and its preparation with milk. Now this rice is not normal rice, it is shashtik rice. We call it as red rice. It is snigdha. Snigdha is snigdha is like oil, like soft. Madhur is sweet. Shita is cold. These properties, Shita doesn't mean that it has to be freezed in the fridge. It has its own, by default, by nature, it is Shita in nature, it is cold in nature. So when we are giving this, it is a good Balya and Brunia drugs. Balya means it is good, strengthful, and gives you more power. Then again, ghee, as we mentioned, clarified butter. Ghee here mentions cow ghee. It is used as aphrodisiac because it is considered good for rasa, shukra, and ojas. Ojas is the end part that we get from all the dhatus. If we are taking it in the right form, in the right manner, it is Rasayana as well as Vayikarana therapy, both. So ghee and milk is the major Vayikarana nutrition that we always prescribe if a patient needs it, particularly for Vayikarana only. Okay, mental agents, we have already discussed what are the mental agents. Like if we want to increase virility or good progeny in a particular person, or male or female, it can be both the patient, you need to have sankalpa, a determination to achieve a particular good regimen or a good dietary schedule, along with the procedures, whatever you can follow, like meditation, like prayers, like sadachar, like you can read some good books. It increases the mental strength, and that contributes significantly towards combating stress, mental disorders, and indirectly it will help you fight with infertility or any sexual disturbances that you're already having. So once, if your physical and mental strength is good, the tissues are in good form, you can easily achieve the benefits of Rasayana and Vayikarana both. Few of the Vayikarana herbs, as I mentioned, if you must have heard about Satabri, Vidari, Jivanti, these are Ayurveda terminologies. So I'll not go too much into it. But yes, I again want to mention Kapikachu, Bucuna prurens. We are using this a lot these days. Arjuna is being used a lot these days. This will not be helpful in Vayikarana only, but yes, these have a lot of properties to help do Rasayana therapies as well in the body. If you're not taking Vayikarana, you are taking it for Rasayana, then also it is very, very helpful. We want to make one's body healthy, both physically as well as mentally. So we want you to have good results and feel healthier in both the ways. So that is why Rasayana and Vayikarana is very important, and has been mentioned clearly in the text that if you are following these practices, these therapies, these are again I'm mentioning, these are not drug therapies. These are regular herbal medicines that we get, and it will help us to improvise our health all over. So we should always follow this. And again, this is not a one-day procedure or a 1 month procedure. It may take some time, but yes, you will definitely get good results if you're following the same. We are getting all the Rasayana and Vayikarana herbs throughout the world. And if you can get a good Ayurveda expert help, it will be a great thing that you can use those particular herbs according to your dosha or your prakriti. So with this, I will conclude. Thank you for the patient listening, and over to you, Mr. Yadranko. Mr. Yadranko?
Yes, thank you very much. Yes, we can now switch off the PowerPoint, and then we come to the normal.
Yes, please, just a minute. Yes, so
yes,
now we can go ahead if somebody has few questions.
Yes, thank you so much for such a comprehensive lecture and elaboration of some practical points also.
Thank you.
And it's reminding me how Ayurveda is the principles of Ayurveda are very, very similar to the principles of the traditional medicines all over the world. And I just remember from this, the science of the herbal science, traditional herbal science in Croatia or some other countries, which are using specific herbs for healing different disorders, using the same Dravya Samanya principle of similarity from the point of the shape, also of the substance, of the color, also, and of the smell, even from that we can get a different experience from different senses.
Yeah.
And then it is actually transferring that quality of intelligence which we are experiencing on the level of the tanmatras of this, which is constituting our subtle body and creating balance on the level of the subtle body and enhancing the balance on the gross physical body from that point of view. And it's really fantastic. And we can see that Ayurveda is very familiar to any part of the world, very familiar to all traditional medicines. We can find common principles. And specifically this, what you gave this lecture, it's very important today because of the stress. And as you know, the main factor which is deteriorating the health of the people is a lot of stress. So the main approach is from the psychical level, that we do something, that we remove that stress. Practice of transcendental meditation, as you are a long-term practitioner, helps in that sense. And along with that, proper diet and achara rasayanas. And as a yoga is giving principles of yama niyama, these 10 main kind of inspiring visions about the life, how life should be, that we have that we install in us tendency for the right way of living, and the health and the diet and all the wisdom, purification, so many things you mentioned, and thank you very much. And I would like to invite anybody who has any question now to use this opportunity to ask our dear Dr. Vishaka. Please, you can connect and ask the questions. So if it's any question, as you mentioned, some substances are very common to every house. They can have in their kitchen, which they can use regularly in their diet every day to support the strength of Shukra Dhatu and consequently the Ojas and the immune system. Yeah. And I remember one from the herbs. There is that bee pollen. You know, this is the Shukra of the plants. Yeah. Which is good actually. Some supplement for our diet regular. Normally, those who are not having allergic to the pollen, in that sense, we need to consider this. But it's very good giving strength and giving vitality, as Patanjali says, virya. Brahmacharya, virya, labdha. That life power to increase. And also the almonds and honey and all like dates. Dates.
Then you can just mix dates and grit together. It is a very good combination if you are using it, and it gives you a lot of strength also. So the combination of herbs is equally important. That is why on every step we always tell, please take the help from an Ayurveda expert, so that whatever you are taking, whatever you are consuming, it should give you good results. Like it should be beneficial in every part. So as you are all, you have mentioned a lot of things. In our own house we have a lot of things that we can take. We can take fresh fruits. Yes, again, fruits cannot be consumed with any other thing. Like people are using fruits with milk. It is prohibited. It is contraindicated in Ayurveda. So if you're taking fruits as a whole, it is much more beneficial than the juices. So if you can take it, obviously increases your rasa dhatu. It improvises rasa, and then again this integration towards shukra is a great help. Then again, milk. If you are taking hot milk with turmeric, it helps you. It helps as an immunomodulator. It helps to improvise strength also. And these seasonal flus that we usually get after change of season, we usually don't get. Or if we get also, the symptoms are very, very less. So these smaller things we can do. We can put in our daily schedule to improvise and help us prevent a lot of diseases, a lot of viruses.
Yeah, and we can see also how the intelligence of nature is organizing the life according to the seasons. Now, when there is a summer very hot, it gives us the watermelons. So a lot of sweet rasa juice, they are available to give to our physiology what is most needed at that time.
Yeah, but that sweetness of nature is easily digested by the body, and it does not move you towards diabetes anywhere. So that sugar is easily digestible, but yes, the raw sugar is not digestible. So fruit sugar is okay, but not the raw sugar.
Yes.
Yeah.
Yes, they say one old man here in Croatia who was studying the way of healthy life, he said there are three white deaths: the white sugar, white salt, and the white flour. Flour.
Yeah, absolutely.
To avoid
Yes,
this as much as possible.
definitely. As
To
much
take,
as possible, we need to avoid these.
yes. Great, and you are cooperating with Ayurveda Balance, Ayurveda Center in Zagreb, in Croatia, and you are coming from some time.
Yes, let's
We'll
hope so.
We'll be very happy to see you coming again.
Yes, absolutely. Ayurveda Balance, a lot of people have connected. Thanks to Tina. She's always connected to me for anything she wanted to check. She is following Ayurveda. She's practicing Ayurveda and doing Panchakarma therapies very well organized. So it is again a help to me also to introduce something. If I tell my patients over there, they readily accept it and follow it. Again, following is the main thing that we usually tell. So it's Ayurveda Balance is again a very good clinic, and people are fortunate to have it there in Zagreb.
Yes, and also people are fortunate to have you as a great expert. I remember you were in Delhi, the biggest Maharishi Ayurveda clinic in Delhi, under the guidance of Dr. Raju, great master of Ayurveda.
Yeah.
You were the main doctor there to organize all activities. Yes. Many hundreds thousand people.
Absolutely.
Great. So please, if there is some question, you can there is some time for asking some specific, what you want to know regarding.
I see a question in the chat box. How much is smoking a problem? I don't smoke a lot, 5 to 8 cigarettes a day, not every day. And I have stopped for a month, a week or 3 months every year. How much is this a problem with my health, as I don't feel the smoking is taking a toll on me? So first of all, I'll thank you for this question. I'll just let you know, whosoever, I cannot say the name, but yes, I can tell you, if you are able to stop smoking for a month, 3 months or 3 weeks, it will be really good if you can stop it all over. Because now it might not have given you a health issue, but as we grow older, as we move towards old age, or if we are having any undue stress suddenly in our own life, this will create a lot of issues in your own body. The respiratory tract, the prana, what we call as prana vayu gets a lot affected, and it disturbs the whole equilibrium of the body. It might not give you disturbance right now, but I am sure that in later stage this will give you a symptoms or disorders. If you are fortunate, if you can give this a break of 3 months or 3 weeks, I would suggest you stop that immediately. If it will be great help. People are not able to withdraw the smoking or alcohol habits, but if you are able to do it, next time whenever you are withdrawing your smoking habit, just withdraw it for your life. It will be great help.
Yes, it's very important because it is drying up the rasa from the body. It is diminishing the rasa value in the body, and also increasing the vata disorder. So,
and affecting the prana. Prana vat is main vat, so it is affecting a lot of prana. So obviously later stage he or she will have issues regarding the same. Anybody has another question?
Yes, one old yogi, Maharishi Swami Demurti, he was.
What are you doing up there?
He said.
Hey.
He said how to get rid of smoking, and he said those who smoke can put the cigarettes near their heart, the package, and then when they get wish to smoke, they can take out the cigarette and look it nicely with love and say to the cigarette, "So I love you so much, I don't want to kill you, and you don't want to kill me. So
wow,
please
that's nice.
come back in your package again and keep it near the heart."
Yeah, very nice thing. Yeah, we all need to do this. Once we'll do it, we'll have very less disorders, because after COVID, we have got a good lesson how to improvise and strengthen our own life, how to become independent and to take decisions for our own life. So COVID has taught us a lot of things.
Yeah, and this is something which we want to stop. We need to stop in a loving way, not in a way of creating hatred against that thing or negative feelings, but just through proper understanding and in a loving nature to go to the right path.
Yeah, exactly. If everybody understands this fact, it will be very easy to follow it also, and we'll be disease free also.
Yes.
So I think there are no more questions, Yadranko.
Yes.
If you say we'll stop the session.
Yes. So once again, thank you so much.
Thank you
for being with us, and so we hope to see you sometime again.
Sure, thank you.
Thank you so much.
Thanks to you, and thanks to all the participants for all the patient listening. Thanks.
Yes, thanks to everybody. All the best. Namaste.
Namaste.
Namaste.